everyone, it's good to have you on this platform again. My name is Dr. Zainab Biu. On today's episode, I will be talking about bovine fasciolosis. Bovine fasciolosis is a parasitic disease of cattle caused by a trematode, usually Fasciola gigantica and rarely Fasciola hepatica. It is commonly referred to as a liver fluke disease or a liver rot in cattle. These terms are usually used because the disease affects the liver. This disease is of public health significance because it is zoonotic, meaning it can be transmitted from animals to humans. This is a postmortem examination that involves examination of the liver and the bile. As you can see, this is the presence of the adult fluke. They are all moving, as you can see. Wow. So upon the visual inspection of the liver, we tried as much as possible to scrape it out by applying pressure, removing all the adult fluke inside the liver and the bile duct, and at the end of this, we marked it fit for human consumption. Actually, the disease is transmitted through a life cycle that involves both the definitive host, which is the cattle, and then the intermediate host, certain species of freshwater snail, the Limnia trochanthula, and then the Limnia auricularia. The disease is more prevalent in areas with high rainfall or irrigation, as the disease favors survival and propagation of intermediate snail. Egg is being released and then excreted in the feces of the infected animal. The eggs hatches in water, release miracidia, the larval stage, which infect the intermediate host, the fresh snail. Then inside the snail, the miracidium develop into a sporocyst, then radia, and finally cercaria, which are released from the snail into the water and attach themselves into the vegetation, where they insist to become metacercaria. The cattle become infected when they eat the vegetation carrying the metacercaria. Once ingested, the metacercaria insist in the duodenum, penetrate intestinal wall, migrate through the abdominal cavity and liver tissue to reach the bile duct, where they mature into the adult fluke. It is more prevalent in areas, like I said, of high rainfall or irrigation, as the condition favors survival and propagation of the intermediate host, which is the freshwater snail. Usually, the predisposing factor of this disease is the environment. As I said earlier, it's more prevalent in areas with high rainfall or irrigation. The grazing practice. The livestock usually acquires infection through ingestion of the metacercaria that are attached to the forage or by drinking water contaminated by the metacercaria attached to the soil, particles of vegetative debris. Also, the presence of the intermediate host, such as the freshwater snail, is crucial for the life cycle of these diseases. Actually, age of the cattle, it usually affects older cattle, and then the sex. This is prevented and controlled through pasture management, controlling the intermediate host, strategic use of antihelminthics, good management practice, preventing the consumption of the metacercaria, and understanding the epidemiology. The disease is of public health significance because it has a zoonotic potential. Humans become infected by consuming water or vegetable contaminated with the metacercaria, the infective stage of the parasite. In humans, the disease can cause liver damage and is often not recognized by medical personnel, hence rarely considered as differential diagnosis. Fasciolosis causes significant economic loss in the livestock industry due to liver contamination in the abattoir, reduced milk yield, decreased weight gain, and increased susceptibility of other diseases. By affecting the health and productivity of livestock, it can indirectly impact food security, particularly in regions where livestock farming is a major source of livelihood. Controlling fasciola can be challenging due to its complex life cycle involving both the definitive host and the intermediate host. So with this, I hope after slaughtering your animals, you allow the veterinarians to do postmortem examination of all the organs to make sure that it's fit for human consumption. Thank you for listening. See you on my next episode. Bye.